Hello and welcome back to the show. Before we dive in today, just a friendly reminder, if you haven't already, please subscribe to the show, share any of the episodes or the show amongst your friends and colleagues. It really helps me grow the show and I really appreciate you doing so. A little bit of a recap, mentorship applications are open still until the end of February. So if you are interested in joining, please do so soon. It is a once a year intake and spots are already filling. There's only a few spots left. So send your applications over and we'll decide together whether this is a good fit for you or not. Just to recap on what the mentorship is about, if you don't already know, it's a 6-month program. We dive deep into pelvic health across the female life cycle. It is very much a highly supportive program. There are one-on-one calls embedded within the program to support you in your learning and your workplace and help you develop maybe a women's health service within your workplace. Maybe you want to branch out on your own and do your own thing within women's health, or maybe you just want to go over some more case studies or practice some skills. They're all designed to be individualized, or the learning is designed to be individualized to you and your career goals. So we have that. We've got 12 group calls across the 6 months where we go into all the exercises and we workshop them together. We go over case studies. We have lots of flexibility for conversations and we can cover other women's health topics that usually gets dribbled in and amongst all the other content as well. There's instructional exercise videos for you to plug and play into your workplace, templates. There are programming examples. There is so much inside this program if you are interested. I recommend checking out the website, www.hereducation.com.au/mentorship. All the links to apply are on that website as well. If you have any questions about the program, you are welcome to send me an email, hello@hereducation.com.au, and I would be more than happy to answer them. If you are looking for other forms of professional development in women's health for this year, we have Spark sessions on the website and we also have collaboration programs. Our Spark sessions are more about clinical conversations with specialists in their field about the particular topics. It's very much like you are talking with a colleague rather than sitting down watching any webinars. They are much shorter in duration, so anywhere between like 45 minutes to 2 hours. We've got PCOS, oncology, there's trauma, there's nutrition for women's health. There are quite a couple of topics on there. You can go and explore those yourself. 2 collaboration programs are live at the moment. There is the Breast Cancer Mastery with Nicola and working with trauma and women's health with Stuart McDonald. And they are both 4-part series with additional 5th. It was like a bonus call when we did the live recordings of these courses, I guess you'd call them. And so we covered any other questions that anyone from the course or program was asking. I think Stuart also did an interview with one of his clients so you could see the real life application of how this content rolls out. Very practical, much more in depth. They are about 7 or 8, I think they're 8 or 9 learning hours roughly, depending on which one you choose. So check them out on the website, jump into them. They are exceptional programs. I learned so much from both of them and I already knew quite a bit about those topics, so I would highly recommend them. Now, let's get stuck into the topic of today, which is a little bit of an extension from last week's topic about feeling confident within your skills. We're working now towards becoming exceptional, why it's important and what it actually means. Now, obviously, this is a women's health podcast, so I mean all of this in relation to women's health, but this can be taken into any part of your work, whether you are working in a whole different industry at the moment and you want to become a bit more exceptional at that, or just an exceptional clinician. All of these concepts can apply across any area. Now, the reason why I want to talk about this is because I believe there is a very big difference in being like a competent and confident clinician and being exceptional at what you do. So in this episode, I really want to talk about what the exceptional clinicians do differently and what you can start thinking about in your own work in order to make that a little bit more of a priority within your career development. Now, when we think of an exceptional clinician, this is one that you probably hear talk about their specialisation and think to yourself, wow, how do they actually know all of that? Or I wish I had that much information in my brain and I could just ramble it off the top of my head instead of having to think about things and go back to all my resources. These are the ones who think more in layers. They think about complexity and how everything feeds into each other and affects all the different areas of getting results for your client. They don't do like checklists or following things to the T. They usually adapt protocols that they already know rather than being super rigid on what they should be following. They understand why things are happening, not just what is happening, and they use that understanding of the why in order to inform their exercise prescription and adapt it and modify it and make it individualized to the person in front of them. They are the clinicians who feel super comfortable sitting with complexity. They don't panic when the progression isn't happening as expected. They don't go into over-explaining everything to their client. They don't feel like they have to convince them that it's not the programming that's the problem and that it's something else in their lifestyle that's feeding into the problems that may have come up since their last consult. And they always seem calm, collected, and know what they're doing. They also do a fantastic job at communicating with their clients. They use appropriate language for the person in front of them. They have empathy, they have soft skills, and they just know how to connect to the person in front of them, no matter who it is. When we think about that whole picture, they have the confidence in their skill set. They have the confidence in their knowledge about whatever it is they're treating, and they also have the soft skills to take their client on the journey from initial consultation all the way through end of treatment. They go deep both in the clinical knowledge skill set application and in self-development. Exceptional work goes beyond just being clinically sound. I think something that gets missed in the conversation about being an exceptional clinician, it's not always just about the programming and doing the right sets and reps and the right protocols and making sure progression is always happening, but it's also about everything surrounding your clinical work. How your service is set up, how accessible and safe does it feel for your clients, how you communicate to your client before they even step into the clinic, but also in your session. Do you hold a strong space for them? And the last thing is how your clients feel when they're with you and when they're not with you. Exceptional clinicians think about their service and how they work with their client as a whole experience, not just what's the program and are outcomes being met, because they understand that the outcomes are influenced by things like feeling safe, connected to the clinician, optimize service so that it takes them through the right journey to actually keep them consistent in their exercise and also actually finish the programs. It's about the pacing and the language that's being used, how the client feels being part of their service. They know how to communicate well without feeling like they're overpowering the conversation. They understand the points in time when they can expand on their explanations and when they need to sit back and listen and let the client do the talking. They know how to adapt their sessions so that the person in front of them knows that they're being heard and cared for and not dismissed or feel overwhelmed. This is why I talk so much about the importance of self-development. You cannot separate the clinician from the care that they provide. Your nervous system, your communication style, your confidence, your ability to self-reflect and tolerate uncertainty all influence the quality of the care that you are giving your client. Inside the mentorship program, the concepts around self-development and being an exceptional clinician outside skill set development are secretly woven in the whole way through. The goal is not just to create clinicians who have all the knowledge and the skills to program correctly, but help the clinicians grow within themselves so that they can be exceptional within their work and provide true high quality care for women, because that is what healthcare for women should be. Exceptional clinicians take concepts and principles from one area and can apply this over multiple areas of their work. One misconception I find myself explaining quite a lot within the stage 2 application calls for the mentorship program is this idea that pelvic health is not just about pelvic floor dysfunction and symptoms of this. In reality, pelvic health is about functional movement and optimizing it. It is about trunk stability. It is about pressure management. It is about load transfer and breathing mechanics, force generation through the arms and the legs. When pelvic health isn't functioning well, then we see compensation through so many other areas of the body. And we get things like back pain and hip pain and knee problems foot problems. It extends from the pelvis to the upper body. So we can have thoracic issues, we can have shoulder mechanics that are now not so optimal and cause shoulder problems. In doing so, also affect the neck. All of these things you have probably seen in your clinic that require a pelvic health approach, and you aren't recognizing them as this because they're not necessarily pelvic floor problems. I want to share a very powerful example of this within the mentorship. One of the mentees from last year worked predominantly within the workers' compensation space. Her long-term goal was to set up some sort of work for herself in the future that was more women's health focused. It wasn't straight away, and it definitely wasn't within the year of the mentorship. She was simply making steps to grow her knowledge, grow her confidence, and then when the timing was right in her life, she would be able to do something for herself and already have all these skill sets developed. Because the mentorship focuses more on systems and processes and the why behind a lot of things and understanding complex layering, she was able to take this knowledge and apply it to her caseload, even though they weren't for pelvic health. She wasn't treating pelvic floor dysfunction, and her clients definitely weren't coming in for pelvic floor problems. She was just applying a pelvic health lens to her work. Within the appropriate parameters of the injuries, she was applying breathing mechanics, pressure management strategies, central stability mechanisms, load transfer, and then understanding functional movement patterns with the ability to progress over time. And the results were outcomes that were so much better than before she was applying this pelvic health lens to her workers' comp clients. And this is because her clients had developed really strong foundations where they were then able to generate force really, really well, align really well, and then be able to safely, progressively overload and strengthen the area that was injured. This is what exceptional practice looks like. It's not about doing pelvic health exercises. It's about knowing how they work and when to apply them for the person in front of you. I honestly believe that this is one of the most powerful parts of specializing properly. When you develop more depth and you have a little bit more confidence, you become like a little bit narrower, but essentially you also become a lot more adaptable to the world that you are working in, and you can see things from a very different perspective that interrelate with other things that are maybe not within that particular area. The final point that I want to make in this episode today is the responsibility that comes with specializing as a clinician and not trying to be exceptional within that role. Women are now moving toward this choice of provider, choosing who they actually go and see rather than being told to go see this one and then trusting their provider that's recommended that. They are doing a lot more research, and they actually want to see someone who is a specialist within their field and doesn't just say that they are a specialist. It is very common that I hear clients in my own clinic say, I went to this clinician because they said they specialized in this particular area, but I got there and I just felt like I knew more about it than they did, and they weren't actually specialists in that field, and I felt really, really disappointed. And now this has affected me in terms of trusting clinicians when they say they actually specialize in something. So if you are going to step into women's health and you're going to specialize in this area, then you need to actually start also becoming exceptional. We owe it to the women that we serve because they are actively looking for people to truly solve their problem, and as they make these decisions and their expectations are not met, we are damaging our reputation within healthcare as both exercise physiologists but also within women's healthcare as a whole. If this resonates with you and you are ready to become more confident within pelvic health and become exceptional at what you do as a clinician, the mentorship applications are open, and I really encourage you to apply. This program is designed for these problems, to specialize, to feel confident, and to become an exceptional clinician so that you can provide true high quality care for the women within your community. Applications are open to the end of February, and we kick off in March. It's a once a year intake, and there are limited spots because there is so much one-on-one support to help you become the clinician that you want to be. I've shared the links to the website that has all the information about the program and links to apply in the show notes, and I would love to see your application come through. Remember, becoming exceptional is about committing to the depth, the responsibility, and continual refinement of your skills to truly change the lives of the women that you serve. Thanks again for being here. I'll see you in the next one.